My name is Dr. Erica Bostick, and I'm an adolescent medicine physician and faculty member of the Clinical Education Initiative, or CEI. I'm here today to talk to you, pediatricians, about expedited partner therapy, aka EPT, for certain sexually transmitted infections, or STIs. By the end of this video, I hope you'll have a better sense of why it's so important for pediatricians to feel confident and competent in including EPT in their scope of practice and how to do it. Let's start with what EPT is. In concept, EPT is when a clinician provides individuals with medication or a prescription to deliver to their sexual partners as presumptive treatment for STIs without completing a clinical assessment of those partners. This may feel like a very strange thing to do, but we'll cover why it's not only okay, but encouraged. Let's address a few of the elephant in the room worries that you may be having before we get into the details of EPT. Number one, liability. As medical providers, medical legal concerns and liability are unfortunately something that many of us think about. In short, per New York State public health law, a healthcare provider who reasonably and in good faith renders EPT in accordance shall not be subject to civil or criminal liability or deemed to have engaged in unprofessional conduct. Even though it's not possible to know the pregnancy or allergy status of partners, the EPT FAQs from New York State says the population level benefits of improved STI partner management outweigh the risk of adverse events and should not preclude the use of EPT. Number two, parents and guardians. New York State law is very clear that minors can consent to STI testing, treatment, and preventative services. This includes EPT. It also is a minor's legal right to have this care confidentially. However, whenever safely possible, it is encouraged to have a parent or guardian involved. But the reality is that it may not always be possible in the eyes of the youth, and fear of disclosure can be a real barrier to care. We've listed some good resources for providing sexual health services to minors and confidentiality in the description to this video below. Now let's get back to the nitty-gritty of EPT. Medical providers can treat the partners of patients with clinical or laboratory evidence of gonorrhea, chlamydia, and trichomonas. For chlamydia, we use doxycycline 100 milligrams orally twice daily for 7 days, or 1 gram of azithromycin in a single dose if there's concerns for adherence or possible pregnancy in the partner. For gonorrhea, you can use 1 dose of cefixime 800 milligrams for the partner alone if chlamydia has been excluded in your patient. If not, then add oral doxycycline 100 milligrams twice daily for 7 days, or again, second line, azithromycin 1 gram if you have concern that the partner could be pregnant. For trichomonas EPT, we use metronidazole 2 grams orally in a single dose. This can be easily referenced on the New York State Department of Health AIDS Institute Clinical Guidelines website for EPT, as well as other resources from New York State listed in the description of this video. Another question that comes up is, when should EPT be prescribed? Any patient you diagnose with gonorrhea, chlamydia, or trichomonas can be offered EPT to give to their partners in the past 60 days or most recent sex partners, with the following exceptions. Number one, if at the time of your visit, your patient has clinical symptoms or lab evidence of a syphilis co-infection. This is because the medications would not completely treat the syphilis infection. However, if your patient has no symptoms of syphilis, though laboratory testing say is pending, this is not a reason to delay giving EPT. Number two, if your patient is a victim of sexual assault, this is in order to protect the victim from further harm and maintain anonymity. And number three is not really an exception, but a consideration for the possible pregnant person. The recommendation is that the potentially pregnant partner seek medical attention ASAP. EPT involving doxycycline should be avoided in potentially pregnant partners, the alternative being azithromycin for chlamydia. So it's important to talk about this possibility with your patient. Another important thing to note is that a clinical diagnosis is sufficient if lab testing is not available or expected. For example, if you're doing a virtual or even an in-person visit with an assigned male at birth describing purulent discharge from the penis, you can go ahead and treat your patient and provide EPT for their partners to cover both gonorrhea and chlamydia based on symptoms. Ideally, you'd be able to send them for lab testing as well, but delaying treatment of your patient and their partner increases the chance of reinfection and new infections to others. If you do send your patient to the lab and it is later revealed that your patient does not have the STI for which they were provided treatment and EPT for, the provider should discuss with the patient the need to inform their partners to contact their own medical providers. So who should prescribe EPT, and why should pediatricians in particular incorporate EPT into their clinical practice? In New York State, any licensed medical provider who is authorized to diagnose and prescribe medications for STIs may provide EPT medications directly or by prescription for chlamydia, gonorrhea, or trichomonas for your patient's partner without prior medical evaluation or clinical assessment of those partners. This is particularly important for pediatricians and other youth-serving medical providers, as nearly 50% of all reported cases of chlamydia, gonorrhea, and syphilis were amongst adolescents and young adults 15 to 24 years old. These are your patients, and we have a huge opportunity in EPT to help prevent our patients from reinfection by reducing as many barriers as possible for their partners to get treatment as well. Big picture, you are playing a huge role in lessening the STI burden in the community that you serve by providing EPT. As a pediatrician, you are empowering your patients to take control of their health, which, as you know, is a critically important concept as pediatric and adolescent patients eventually transition to the adult model of care, which can be challenging. You can feel confident in the efficacy of EPT. There is strong evidence supporting EPT based on 3 U.S. clinical trials, which showed less reinfection in patients and more partners being treated. Reductions in chlamydia prevalence at follow-up were approximately 20%, and reductions in gonorrhea were approximately 50% at follow-up. Pediatricians providing EPT is supported by both the American Academy of Pediatrics and the Society for Adolescent Health and Medicine, with the AAP's own Dr. Burstein as lead author on the position paper. So we've spoken about the who, what, when, and why of EPT. Let's spend a few minutes on the how. Let's say you are a pediatrician seeing a 15-year-old assigned female patient who tested positive for chlamydia and has had 1 lifetime partner. Your options for EPT are: write a prescription for EPT and give it to your patient to give to their partner or partners. In this situation, their partners are responsible for paying for the medication via cash, card, or their own insurance. There are also some coupons available through GoodRx, for example. EPT may be prescribed electronically, which varies between electronic health record systems. However, it is exempt from the New York State e-prescription mandate and can also be written on an official New York State prescription form. If you don't have any paper prescriptions, you can request them for free. See the link in the description. Whenever a healthcare practitioner provides EPT using a prescription, the prescription should include the following listed here. If the name, address, and date of birth of the sex partners are available at the time the prescription is written, this should be written in the designated area of the prescription form. If not, just writing EPT is sufficient for the pharmacist to fill the paper prescription. When issuing an electronic prescription, include the following. And let's assume that you don't have the name, address, and date of birth of the partners at the time you are prescribing. And as a reminder, according to New York State Public Health Law, Section 2312, a pharmacist can fill a prescription with the designation of EPT, even when a sex partner's name, address, and date of birth are not listed on the prescription. Back to the case of our 15-year-old with chlamydia. The second and preferred option for providing EPT for your patient's partners would be handing the actual medication itself to the patient to give to the partner directly, also known as the medication in hand model. This eliminates any barriers that may be related to pharmacy, the potential inability for the partner to pay for the medication out of pocket, or if they're uninsured, all of which you as the clinician won't know ahead of time. If a patient's partner can't afford the EPT medications, they can be referred to the local health department's sexual health clinic. See the description below for more information. Pediatric practices that are hospital-owned may be able to explore 340B prices. Other practices may be eligible for government pricing to stock their clinic. EPT medications or prescriptions must be accompanied with educational materials, including treatment instructions, warnings about taking the medications, for example, if the partner is pregnant or has an allergy to the medication, general health counseling, and a statement advising the partner seek medical evaluation as soon as possible for HIV infection and other symptoms of STIs, particularly PID. See the link in the description for EPT educational pamphlets in both English and Spanish that you can access for free from New York State. Of note, New York State allows for these materials to be distributed via web link and other technology-based means. And again, for minors, EPT qualifies as a prevention service. So if your less than 18-year-old patient is able to give informed consent, giving EPT to a minor is allowable and, as mentioned previously, encouraged and supported. In summary, EPT is not only within the scope of practice of pediatric providers, but is a unique opportunity to put the preventative medicine spirit of pediatrics into action with a significant public health impact. So have sexual health conversations with your patients, offer routine screening for STIs, and if you have clinical or laboratory concern for gonorrhea, chlamydia, or trichomonas, treat your patient and provide them with EPT for their partners within the last 60 days. Please check out the resources below and visit our website at www.ceitraining.org for more sexual health trainings.